So can you see the slide? All good?
Yes, bro.
Okay. Yeah, so last week we started from this topic, wound management. So what is wound management? So the concept of treating a wound today is totally different from 20 years ago. So the principle is to provide appropriate environment for healing by using either any direct or indirect method together to prevent the skin breakdown. So give the healing a good, appropriate environment is the principle. And what is moist wound management? Yeah, because that is the modern wound treatment concept. Yeah, moist wound management is just maintaining a moisture environment between the wound and the dressing. So you have to create an environment to keep the moisture not too dry or also not too wet as well. Because a good appropriate environment can allow or help the cell division. Normally the temperature would be good if you can keep it like your body temperature, 37 degrees. And also if you can cover the good dressing, the modern dressing, to prevent the dehydration. And also that environment, the moist wound management can prevent or cause less scar. So that is moist wound management. But when too much moisture, it can cause maceration. When the skin is too dry, it will cause desiccation. So that's the difference. So we want your wound to be managed under appropriate moisture, not too dry and not too moisture. Okay, so 37 degree, yeah, to keep it. So if we can cover the proper dressing, then definitely we can keep it like 37 degrees. And also we have to deal with any exudate, which is discharge from the wound. And also the moisture can, the dressing can prevent dehydration. And that's the dressing. See, you can see modern day, there are so many different dressing. 所以从这个地方你可以看到这个这些伤口的敷料哈，你看有大概10几20种所以我会介绍其中几种。So in this lecture, we will talk about most of them and give you an idea what sort of dressing you can select when you decided to treat a wound. And the difference between the traditional and the modern day is the first is the dressing type and also the antiseptic use. For nowadays, we use less antiseptic. We try not to use too much antiseptic when you change the dressing, like betadine or we try to use less. Most of the wound are quite clean, so you only need to, after clean your wound, you only apply the antiseptic only once, and then cover with dressing, and wait until 2 or 3 days when you change the dressing. Sometimes you don't even need to put any antiseptic. Yeah, because the more antiseptic you put it on, the less healing they're going to form. So try not to use too much antiseptic. If possible, you only use the first time when you do the dressing, And the second time when you change your dressing, just see how it goes. And most of the wound, you don't need to apply this antiseptic for the second time. And also the difference between the traditional and nowadays is how often you change your dressing. Because in the past, when you use the traditional Band-Aid, you have to change when you like sometimes it is on your hand. If you have a shower or when your dressing get wet, you need to change it. But the modern day dressing is waterproof and also is breathable. So you don't have to change the dressing every day. You can change the dressing sometime 2 days, 3 days, even 4 days until the dressing comes off the womb. Yeah. And also in the past, the traditional one tend to get skin maceration, which is too much moisture. But the modern day one, because it's a film and it's also breathable film, so it will cause less maceration for the skin. Okay, and the dressing between the traditional one and the modern day is during the old day, you normally use the gauze or cotton wool, or use the combine or tool. And also it's expensive because for those dressing, sometimes it's made by silk or any like nature material. So sometimes it's expensive. And also because you change the dressing every day, so it costs more. And yet frequent changes. And also when you remove the dressing every day, it's quite painful. But for the modern day, is sometimes you apply the dressing which can absorb the discharge or exudate, or sometimes you don't need to put the absorbing thing. And also when the womb is too dry, you can provide the dressing can offer, or we call moisture donating. They can put more moisture into the womb to prevent the womb to become too dry. And also it's less frequent change. You probably change only 2 days, 3 days, even 4 days. Yeah. So that's why it's cheap. And also when you remove every 2 or 3 days, definitely is will cause less pain. That's the traditional one. The combine dressing is look like this. Sometimes can comes in a roll, see like the photo on the left, and sometimes comes in a pad. So this is we call combine. Combine dressing, it can absorb the discharge for the womb. And the left hand side photo that's for tube，这是一种纱布，有时候会放那个液体，那个所谓的石蜡。So the tool, sometimes we put paraffin or sometimes without paraffin. So that's traditional dressing. And for the modern day dressing, the first one I'm going to introduce is called non-absorbing dressing or less or for near to low exudate. 所以这样子的一个敷料呢，它是不许，它中间有的是，so you can look at the dressing in the center, you can see something like we call island dressing. Island dressing is something in the middle that small patch can absorb the discharge. Or sometimes you can just only put the film without the island one, without the gore in the middle. Yeah. And this dressing is waterproof and gas vapor permeable, which is we call breathable. 所以这种敷料呢，它是我们说是 breathable，就是可以呼吸的，所以它的那个湿气不会一直待在你的那个伤口，它会 它会自我调节，and also it's flexible and also protect this your wound from any friction or any bacteria or shear, and also it's transparent, so you can see how's going. Is it healing good or something wrong with a wound? You can see it straight away. Okay. So this is film dressing, a very big film dressing. So let's look at the video to see how to remove the dressing, and they will also introduce what's kind of dressing and how you can put the dressing on the skin. 所以我们会看一个影片，就是怎么样把那个敷料，把这种 dressing 把它放上去哦。嗯，This mini security camera created by two. Sorry. Transparent film made of. Second. Sure. Yes. Transparent polyurethane. Okay. A transparent film dressing is made of thin, transparent polyurethane coated with an adhesive. It's used to promote a moist healing environment, autolytic debridement, and for protection from mechanical trauma and bacterial invasion. It's available in a variety of sizes and shapes. It's waterproof and impermeable to bacteria and contaminants. It should be changed every 1 to 7 days, depending upon the position, type, and size of the wound, and upon manufacturer recommendation. To apply transparent film dressing, after cleaning the area, clean the surrounding tissue with alcohol pad. This is known as defatting the skin, which will help the dressing adhere better. Apply the liquid barrier film to the peri-wound area to protect and assist with adhesion. For deep wounds, apply a wound filler or packing materials as needed. Peel the liner from the dressing, exposing the adhesive surface. View the wound site through the film and center the dressing over the wound. Do not stretch the dressing during the application. Smooth the dressing in place from the center outward. The dressing should be at least 1 inch larger than the wound. Check the individual manufacturer recommendations, as some require a 2-inch border. To remove a transparent film dressing, lift one corner of the dressing and stretch horizontal along the skin surface. Continue stretching from the edges toward the center. When two sides of the dressing are lifting, grasp both sides and stretch horizontal and parallel to the skin until the entire dressing lifts. Okay, so that video just trying to show you how to apply the film dressing, the big one. And also when you try to remove the film dressing, is slightly different from the normal dressing. You just pour on the corner of the dressing and just use your just extend it, and you will slowly and remove that dressing. And the next one is absorbing dressing. So when it say is absorbing dressing, mean this dressing can absorb something, especially so normally on the market you can see this brand called Eleven. Eleven dressing as adhesive, adhesive dressing. Normally it's a hydrocellular dressing with a breathable top film for faster food removal. And below the top film layer is a foam layer for absorption. And this kind of dressing can remove the fluid or any discharge faster than regular dressing. So when you are treating the wound, it's very got a lot of discharge. 所以这个伤口如果有时候它是很多的脓的时候，一般的这个 dressing 是没有办法可以吸收这些 discharge。So when the womb got a lot of discharge, you have to select something can absorb those fluid faster. So that's why you have to think of something. See that that patch is very big, so that can help you to help the patient help the womb. Any discharge can be absorbed quicker. And also another different type of absorbing dressing. If the discharge is medium or high exudate, we will consider this one. See, it's called alginate. Alginate is a product from it extract from seaweed. And when this alginate mix with any water or discharge exudate, it will become or form like a gel. And because it's gel, it's very easy to remove. And also alginate can help to stop bleeding. But this type of dressing, you need to put a secondary dressing on top. 所以这个是属于 alginate，就是从这个海草藻类去提炼出来的，所以它有止血的作用，而且它可以很快的去移除。但是使用这个 dressing 的话，你需要在外面再贴上一个第二层的这个敷料。Okay, alginate dressing normally is used for ulcer. For example, the ulcer caused by diabetes, or sometimes because the venous insufficiency, 就是你的末梢血管的供血不足造成的这个 ulcer, or is a pressure wound, pressure ulcer, when people they wound driven for a long time, sometimes on the they can cause some ulcer. So for this type of ulcer, you probably need to use the alginate dressing. Yeah, because normally there's a cavity. So that's why you need something to cover that area. And alginate dressing also used for surgical wound, or sometimes for burn, first or second degree burn. And for donor side, 这个或者是皮肤移植的时候，有时候 we use that dressing to absorb too much like discharge or even the moisture. And silicone dressing, so this is help to reduce the scar. So in any like some plastic surgery clinic, they use this one a lot, especially after the surgery. They have the wound for stitches. So on top, when they put this silicone dressing, they can reduce the scar forming, and also because it's can attach on the skin, so you stay there. It's gel-like. 所以这是这种normally the brand you will see on the market is called Sika Care，Sika Care，这是一种类似细胶类的这种 dressing，它可以放在这些伤口上，可以防止这个疤的形成。OK，moisture donating dressing， yeah. Because for some wound, sometimes can be a little bit dry. So if you don't put any moisture donating dressing, the wound won't be healed properly. So normally for hydrogel or this brand is called Solugel. It can help to rehydrate the wound or the wound got a cavity. So in this area, you just put that gel to make it like even or flat. And also this sort of gel can help the wound to like we call autolytic debridement. Yeah, when your skin is healing, your skin will debride themselves. So if you put this gel on top, it will help the whole process to run easier. And also for this gel, you can remove with normal saline. Yeah, when you use the normal saline to clean it, it can be removed very easy and quicker. And sometimes you don't, but this dressing, you need a secondary dressing on top. Okay, the next one is hydrocolloid dressing. Yeah. So this dressing can also provide a barrier like a film. Yeah, it's a film. And also you can see this is the dressing in this offer a very like there's a material can help to control the pH value inside this area, and also the so when you keep the pH in a certain level, that can reduce the bacterial growth, and also can help to maintain the moisture. So this is hydrocolloid dressing. And codexamer iodine dressing. So when you see there's iodine, mean this one can work as can kill the germ, right? So and also this the base for the dressing can help to absorb too much estrogen and also release the iodine. Okay. But this iodine is on a very low concentration, so it won't cause any damage for your cell. Yeah, we call cytotoxic. And also normally for infected womb, and also the iodine can also stimulate the growth for your skin. So we talk about the traditional tool, but that's the modern tool is which is no paraffin. Yeah. Cartesian. Yeah, Cartesian. 这种是没有这种 liquid paraffin. So if the womb you need something to cover, and this one can be can be another good option to use to cover the womb. Okay. The other thing we can use is the hypertonic saline. We know when we clean the wound, we normally use the normal saline, right? But when the wound use normal saline to clean, sometimes can cause granulation tissue. because there's too much moisture or water there. So when you use hypertonic, it can cause osmotic pressure that can reduce the granulation. 所以这个是属于叫做高张浓度比较高的这个生理食盐水。那它可以防止这个伤口，有时候我们长期使用这个一般的正常的生理食盐水的时候，会造成那个有颗粒化的组织产生。那使用高张的 hypertonic saline can reduce the granulation tissue because it can offer a very high osmotic pressure. But you have to change this sort of type of dressing daily. Normal saline is 0.9% sodium chloride, but hypertonic sometimes can go up to like 3% or 4%. I don't know whether you heard about this hypertonic saline. Yeah, just think about it because it's still a very new way of treating wound. So you probably still haven't heard of this one, but just have an idea in mind. Okay. And also there's a sodium chloride dressing. Yeah. Yeah. So sodium chloride can reduce the bacterial growth. So sometimes when you put it on some wound, it can help to reduce the bacterial growth. And also the honey in the wound care. Yeah, you know, honey, it can, when you treat those ulcer and burn, honey can the first offer a very good, that can contain or a moisture in the area, and also in the honey, it can put, because in the honey you can see one of the ingredient in the honey is very lower strength of hydroperoxide. 所以在蜂蜜里面呢，它也是含有这些所谓的过氧化物，所以它可以帮助杀菌啊。所以说用这个蜂蜜 use honey to treat wound, yeah, it's quite common now. Yeah, because it's antibacterial phytochemical. And for wound, different type of wound, we have different way of treating it, like laceration, or grass, or burn, or skin tear, or even after the operation incision wound. 所以伤口有很多种啊，所以说每一种伤口我们都有不同的这个治疗的方式，我们会介绍这几种以下这种伤口我们会怎么处理。第一个 laceration 就是我们的切伤或者是裂伤。So the first how we treat the laceration, yeah, you have to wash and remove the excess foreign material with any surfactant wash. 可能用一些这个肥皂啦，这些界面活化剂的东西去清理伤口。And then you can, if there's any bleeding, you can stop bleeding. Try to either use the pressure, the red pressure, or use the homostatic alginate. Yeah, we talk about alginate can help to stop bleeding. So for this type of wound, you have to find out any way to stop bleeding first. So if necessary, you just apply the strip. 因为切伤或者撕裂伤，那个伤口是 the wound is open, so you need a strip to help it close. And then after you've done that, you cover with film or even an island film dressing. 所以当你做完伤口的处理，外面你可能就要加上一些 一些敷料这些 dressing，那这个 dressing 可以选择没有中间没有那个可以选择有 island 的，或者是就只有 film 这种 dressing。那 grace 呢，就是擦伤，就是那擦伤的话，you have to swab the grace with a good surfactant and wash to remove any contamination。所以说擦伤有时候伤口会有一些脏东西，所以你还是要洗干净，然后移除这些伤口的这些受感染的这些东西，这些脏的东西。Then apply a topical antiseptic. So because it's great, so great. So sometimes you have to, yeah, because might be some bacterial in the area, so you need to use the antiseptic. So compare with the laceration, yeah，刚刚那个切裂伤，因为它是一种比较干净的伤口，有时候甚至你不需要那个 antiseptic，不需要这些杀菌的东西啊。但是这种擦伤的 grace，you need to put a antiseptic and try to use less. So only the first time. So apply either with the island film or hydrocolloidal or the foam dressing。所以说你在选择伤口的时候，选择 dressing 的时候，consider whether the wound got any discharge or not, or a lot of discharge or not much discharge. So you have to select which type of dressing will be better. Then after you put the dressing, you might have to put cohesive, the secondary band-aid or dressing. And the burn, how do you treat burn? You normally you have to cool the area down. So normally running water for normally between 5 to 25 degrees for 30 minutes, but do not use any ice. Yeah, if there's a burn. 所以一般如果你有烧伤的话，就是用在水龙头下一直去让它可能让它洗大概这里写了30分钟了，就是 try your if you can do 30 minutes, yeah. So normally temperature, the best temperature will be around 15 degrees, yeah, because sometimes when temperature is too cold, it can cause the uh, um, different damage for the skin. Yeah. See, temperature is below 5 degrees may deepen the burn. Okay. And also, what if you have to watch hypothermia，就是有时候可能你温度太低，你可能还要造成失温。如果你的那个伤口的范围过大，那你用这种温度比较低的这种running water 可能会造成失温。Then wrap the patient in clean sheet or towel to keep warm. Okay, for the dressing for the burn, normally you have to consider any dressing can absorb those water acid day because normally for the burn，因为这个烧伤有时候那个皮肤会有渗出很多的这些水分，所以你在选择 dressing 的时候，可能要考虑到有一些这些啊、铺上一些东西可以吸收这些 discharged water moisture and also prevent the infection. And also how do we keep a wound ideal wound healing environment is also important. And also knowing for burn can be very painful. So how can you reduce the pain? So put it in the running water. It can cool the area down, can help for the pain. Sometimes we'll consider the hydrogel. Hydrogel can absorb too much moisture comes out and also maintain a good moisture there in the area, and also can cool down the area. So normally, if that's a dressing, we normally consider the hydrogel. And for the burn dressing, for the burn, you need to change the dressing, very often. Yeah，因为这些水分的渗出物，所以你的那个伤口的敷料可能要经常的更换。Okay. So for the burn dressing, normally is there's a two brand, Fixable or Hyperfix. Yeah, is a adhesive tape. 这种 dressing 的话，它是一种会很浓，它会粘，它是一种有粘性的而且它是可以stretchable，它并不是 non-woven。So it can stretch to the burning area and stick on the area. And also is skin friendly. Because for those dressing, for the burn, you have to change the dressing very often. So if you select a dressing which is very hard to remove, it's no good for the wound healing too. Okay, and the adhesive thing will ensure the dressing is firmly secure on all sides, and also cannot slip and become detached. 所以说它必须吸附在这个皮肤上，而且皮肤有很多的这些渗出物，所以说如果它的吸附性不是很好的话，有时候可能就容易就掉了。So that is fixable or hyperfix，所以它是长这个样子的如果你看到这样子的一个 dressing，你知道这个是一种特别是可以它有弹性的，然后可以固定在伤口。那特别是我们会常用在这个比较烧烫伤。Okay, and the next one is skin tear. So the treatment first is you stop the bleeding. And if there's a lot of bleeding, you need to consider alginate sheet to help to stop bleeding. And normally clean the wound, you just gentle use tap water or normal saline, and just use any cloth to pat dry. And if the skin is black, you have to roll the skin back. Okay. Then put this tiny strip. Yeah. Okay. So this is steri strip. So you can buy this one, I think in pharmacy. So you have very tiny skin tear, you can consider use this one to help the skin to close better. And normally between the strip is about maximum 1 centimeter apart. 所以这个每一个小小的 strip 呢，就是最宽不要超过1公分这样你的伤口的那个才可以帮助它愈合的比较好。And also, sometimes you might consider use any dressing like hydrogel if the skin or wound is dry, or any foam dressing. 这个 foam 就是一些比较有海绵，可以缓冲一些就是这些具有缓冲的一个功能的一种 dressing， 可以起到保护的作用。So this foam normally is non-adhesive and also can keep the temperature stable, and also can protect the area too, and mark the direction of skin flake on the dressing. 所以在这个伤口的地方，那个皮肤有时候它是可能裂开，是从某个方向裂开的，所以你不希望你打开的时候又是从同一个方向打开，那造成又是二次伤害。So make sure you can mark on the dressing, you make just mark the direction where the skin flare. And that way, when you want to remove the dressing, you do it from the other direction, so can reduce the damage when you change the dressing or band-aid. Okay, and sometimes you might have to trash any dressing which can help to retain the dressing. So something like tubic grip，这种 tubic grip 是一种好像一种管状的一种好像弹性绷带的东西，那你把它套上去啊，或者是直接就像这种弹性绷带，你可以把它缠上去。So try not to use the adhesive tape 啊，因为这些比较越黏的这种 tape 的话，当你在移除的时候，可能会造成这个伤口的二次伤害。Okay, so that's why we use the cohesive band-aid or tubic grip. Okay, for skincare, if you have to use analgesia，就是一些止痛剂的话，可能而且如果是有时候这种皮肤的这些擦伤啊，有时候我们可能要 check 看看需不需要打这个破伤风 tetanus 的 status，也看他上一次，因为这些破伤风通常你呃打一针，通常它有几年的这个效期，所以你要看看他是不是有打过，如果没有的话，最好去打一下。So we have to check the tetanus status. So just check, see whether when the patient had the tetanus injection, vaccination, see how long. Normally, after the injection, it can protect you for about 2 or 3 years or something. Hmm. And also continue with the foam dressing or even the gel one when required. And sometimes consider the zinc paste if the skin is lost. 因为有时候那个伤口，那整个皮好像都掉下来，所以这个完全没有什么保护了。所以这个时候你可能要使用这种新的这种 zinc paste to cover the area to like just make a barrier from the other outer thing. So consider whether skin is still okay or it's been lost. You need to put the something on top. And when to refer. So most of the simple wound you can heal very quick, but the following thing we is a sign for the pharmacist for you to refer to the doctor. The first one, if the bleeding it doesn't stop with any way or measure you try the bleeding still you still can't stop the bleeding, then see the doctor or refer to the doctor. Or increase in wound reopen or fail to heal，就是这个皮肤呢，它的愈合不好，它一直不断的去容易掉下来，或常常就是容易 reopen，那你可能要 refer。Or the wound doesn't heal even after several weeks of treatment. So normally a skin will heal in a week. So after a couple of weeks still not healing, so could be something the underlying disease, diabetes or some sort of problem with for the individual. So we don't know. Then you have to refer to the doctor. Or if the wound you can smell the wound is sting or something. That could be bacteria or fungal involved. Then we probably have to refer to the doctor. And also if the womb service looks a bit unusual. So that's all the sign if you have to refer to the doctor. Okay, so one case, Mr. Wong on a toe has got a very tiny wound and he want to buy the betadine. Sorry about this one, got only Chinese. So this gentleman, his toes got a very tiny wound and he want to buy betadine. So what question would you ask? Yeah. If you are a pharmacist, would you sell him betadine? Because he just say, "Oh, can I buy betadine for my tiny wound under my toe?"
那个伤口是怎么受伤的？
就是可能就是突然之间发现的，他突然之间发现。So he just one day he just look at his toe and he just realized, oh, there's a worm and very tiny. Any question would you ask? 玉芬，你会直接就卖给他优点了吗
嗯，呃，我应该会先，我会不止给他优点，还有食盐水，因为我不知道他有没有清洁那个伤口。
？Okay. Sabir, yeah, if this gentleman came in and say, "Oh, can you give me a better thing?" Would you sell it to him?
Uh, yes, Professor. Firstly, I will ask him or her how do you get this wound and how it is from how many days
Oh,
and any treatment you take or any medication you take for
yeah.
this.
Okay. So how long? Okay. So remember that approach. Okay. Are you the patient? How long you have the symptom? Okay. Uh, any other symptom or any medical condition, right? But in this case, Mr. Wong, he's a diabetes patient. Yeah. For any diabetes patient, for the wound healing, because any diabetes, any tiny wound, that can be very dangerous or vital for them. And the people might die, or maybe even later they have to cut their leg because of that tiny wound. 所以任何糖尿病的病人，他们脚上有伤口，因为 so those diabetes patients normally they have very poor circulation in the peripheral tissue. So that's why sometimes when they notice any wound, the wound probably is already there for a long time. And for any diabetes patient, the wound, definitely you can sell them the Betadine or any normal selling any trading, not a problem. But for diabetes patient who's got a wound, you need to refer to the doctor. And they probably need an antibiotic. Yeah, because if they don't treat, because the healing for any diabetes patient is very hard. It sometimes may take months or even year to heal. Yeah, my father-in-law, he's got the same thing. He's got a very tiny wound in his toe. But it took him, like after 2 years, the wound still there. 所以说，任何有糖尿病的这个病人有伤口的话，我们都要把它视为他可能会死于这个伤口或者是因为这个伤口他可能要截肢，那所以我们要把它转给医生，而且他一定可能会需要抗生素或者比较积极的这种去治疗他的伤口，而且通常他的脚的这些感觉可能都已经没有什么感觉了，所以为什么他有时候突然之间才会发现，他们觉得没事，可是脚上有一个伤口，可是也不会很痛，因为他们的那个痛觉的神经已经没有了。Okay, so for this patient, yeah, ask all the question, yeah, and diabetes patient refer to the doctor, and they need an antibiotic.